Okay, here we are. Welcome everyone and thank you for joining us for the September 2025 Rural Health Association of Utah's Rural Resource Series. My name is Kristen Shakespeare, and I am a volunteer with the Rural Health Association of Utah, and I'm stepping in for Casey today to help run this series while he has some other very important engagements to attend to. We appreciate the flexibility of our attendees to move this month's session back a week. This monthly webinar series highlights practical tools and programs that rural healthcare professionals across Utah may not yet be tapping into. Our goal is to strengthen rural health outcomes by connecting professionals with underutilized resources and one another. You can find session recordings and materials at www.rhau.org/wow webinar series, where we're actively building a comprehensive on-demand library tailored to rural Utah's healthcare needs. And I can put that into the chat if you'd like to access those resources. We deeply appreciate your participation today. It is your involvement that makes this work meaningful. A special thanks go to the Intermountain Health Foundation for their generous support in bringing this series to life. Okay, today's agenda is as follows. We have two presenters. The first presenter will be Jennifer Morgan, who will be discussing the Cover to Cover program. Following Jennifer, we will hear from Sydney Grant from the Centers of Rural Health Leadership. Each presenter will have a 5-minute Q&A session that will follow their presentation. So Jen Morgan, I will go ahead and pass it off to you.
Great, thank you so much. I appreciate it. I'm very excited to be here today to talk about a program that we developed here in Utah that helps better serve veterans and their caregivers. I am the program manager of the Cover to Cover program, and that stands for Connecting Older Veterans, especially rural, to community or veteran eligible resources. And I'm up at Utah State University. When we developed the program in 2013, I was working closely with the area agencies on aging, and we were looking at a funding opportunity through the VA Office of Rural Health. So we did a little kind of looking at gaps of services. We knew within our state and kind of collectively nationally that community-based organizations don't often get a lot of training on VA benefits. So we thought there might be a gap there. So if we can go to the next slide. So I'm just gonna give you a little bit of background on the Cover to Cover program and kind of give you a few, I don't know, tips and nuggets of information. And then ultimately, I'm gonna give you great resources of people that are working in rural Utah that help connect VA veterans to VA benefits. So just if you give me a minute to give you some background of the why. So we, in 2012, as prepping for this grant, we did a national survey to organizations that serve older adults and people with disabilities. So ADRC is Aging and Disability Resource Connection. One of the questions that we asked in the survey was, do you regularly assess a caller's veteran status? So you can see about 95%, always or usually ask that question. But we kind of had an idea that maybe they were just checking a box. They were asking, but maybe they didn't know what to ask after that. So some of the comments that were presented for staff is that they lack basic information about VA benefits. Some of the resources aren't that helpful, but the most positive feelings about resources was having a personal contact at the VA. So someone you can just pick up the phone and call. Next, please. And so then we wanted to look, okay, consider how do veterans understand their benefits? And I get this report is old, 2010, but I'm going to say that it probably stands pretty solid still. that 41% of veterans stated they understood their VA benefits a lot or some. So, I mean, the reality is a lot of veterans just don't get connected to their benefits. And some of the misperceptions that came out on this particular survey, that veterans think that their income is too high for any assistance. They're not eligible because they didn't serve in combat. Other veterans are more deserving, which I probably should put that on the top of the list because we hear that a lot. I don't know. I think maybe some people on the call have served in the military, but we all are connected with family members that have served, and we hear that a lot. And then some distrust of the VA. So rather than veterans reaching out directly to the VA, when in need, they turn to community agencies where they live for whatever resources that they need, but they're not tapping into the VA. We serve about 800 to 1,000 veterans per year, and that's direct. We do a lot of outreach in other ways, but this is kind of one-on-one. And right now we're serving a lot of Vietnam veterans, and many of them have health conditions connected to their service, and we want to get them connected to their benefits. Next, please. So we were funded to run with the Cover to Cover. The acronym is, we partnered with the VA, so it has to have an acronym. But it really, I feel like we have done a really great job in breaking barriers between the VA and community. That's unique, and it doesn't always happen like that. So we were funded for about 3.5 years, and expanded to other states regionally. But our goal was to create a no wrong door experience for veterans. So when they called an area agency on aging, that they actually could get information and help applying for VA benefits or public or private programs. Next slide. Our objectives for the program was really big push on training. So train community agency staff. I mean, we had our core that received funding, but we opened it up to anybody that wanted to come. And this being 2013, it was all in person. And then we also wanted to build these relationships between VA and the community, and ultimately create a new access point for veterans within the community that they live. So then conceptually, we thought, oh, we'll have a lot of training, and then, we'll have a lot of meetings and build this partnership. But what happened was the training events, we had 7 months in a row. So every month we kind of had the same training over and over. It was the training that laid the foundation for the partnership development, because we were meeting each other in person, getting to know each other, and that really helped. Can I get your direct line? Can I call you later if I have questions? And that's really what developed the relationship. Was there a question or no? No, okay. So next slide. So as we jumped into this, we thought, okay, are we going to have to start advertising that, hey, we are serving veterans now? But really the most pivotal point was changing the question versus asking, are you a veteran? The question we changed to, have you or a loved one served in the military? Or do you care for someone who has served in the military? And we found that veterans were already calling our agencies. We just weren't identifying them. And with these questions, it really helped get, more yeses. Sometimes veterans don't identify as being a veteran. And so this is just kind of a more direct question that was very helpful. Next slide. Okay, so I'm going to give you all, I'm going to guess that, just being a community-based organization, like we don't always know how the VA works. And this was a big piece of our training, that we had to learn how to navigate the system before we could really help veterans and their families through the process. So I'm just going to give a little bit of kind of mapping of, like, how you navigate the VA. Just because I know there's a lot of frustration within the community in understanding the navigating it, and then also veterans, obviously. Unfortunately, we hear a lot that veterans just sometimes will just give up because they can't figure it out. So this is just to give you kind of a big picture. So the VA, Department of Veteran Affairs, has 3 federal branches. So we have the Veterans Health Administration, so that's the hospitals, in-home services, caregiver support programs, those kind of things. And then the next door is the Veterans Benefits Administration, VBA. And that would be anything that a veteran would apply for that would attach money. So that could be service, compensation, pension, aid in attendance, GI Bill. That's what that administration does. And then we have the National Cemetery Administration, NCA, and it's really exciting. Hopefully you all have heard that we are getting a national cemetery in Cedar City, and I'm hoping that is going to be revealed and kicked off soon. And I really think they picked kind of the middle of the state, but because it doesn't matter where a veteran would live, anybody in Utah would be eligible, including their spouses, to use the burial services there. Okay, next slide. And then every state has a state Department of Veteran Affairs. So our state is the Utah Department of Veteran and Military Affairs, UDVMA. I'm going to give you lots of acronyms here, and you'll get the slides so you can go back and quiz yourself. So each state has one. Ours is amazing. They provide education to veterans, family members, caregivers, survivors about VA benefits. They employ veteran service officers that are accredited to help veterans file for benefits, and they engage in outreach events. It's probably one of our longest partnerships that has turned into friendships, and we often ask them if we're having a health fair or any kind of conference, if they would want to come and support the event, either by presenting or just having a resource table. So they're amazing partners, and we work very closely with them. Their model is kind of, their offices in Salt Lake, but then they have kind of a regional map that basically there's VSOs that are in certain areas of the state. So wherever you live, there's somebody, and more than happy to help you find them. Okay, and the next slide. Okay, so obviously I'm a visual person, and I like this map of, I'll say the VA, right? Because it's all kind of put in one basket, but it's not. So in Salt Lake, I've worked with multiple VAs, and I feel like ours is somewhat unique, that we have a lot of kind of the players all on one campus. So we have the VHA, so the hospital system is there. The VBA, so the benefit office, is also there, that processes claims. They sometimes call it their regional office. And then we have our State Department of Veteran Affairs as well. And so it's great. It's all on one campus, and we have the veterans home. So I like the visual, and I like the idea of, like, we say the VA. So we find that sometimes we'll talk to veterans that said, oh, I applied at the VA and I wasn't eligible. So that needs a follow-up question, because we want to find out, they might have applied in one doorway and were not eligible, but maybe they didn't even apply for healthcare. So there's not one door on this campus that a veteran can walk into. So we want to follow up with questions because they may be eligible for a benefit. Which brings in the cover to cover program, because we do all that. They can walk into that one door. And you can go to the next slide, thanks. You can go into the one door and get all sorts of help. So how do we help veterans? So we have, in the beginning of the model, as we were training staff, we would identify one staff person at each location to be a veterans benefits specialist. Since we've grown, we have 2 of our sites, actually, the social workers that started, were able to also get accredited to be a VSO. So it's a very unique model to have a staff that's also a VSO that can help provide VA and public program benefits counseling all in one stop. We help veterans and their families navigate the VA system. So that not only the system, but then also just say if we help a veteran get enrolled in healthcare, they help talk about what are the next 3 steps you need to make. If you need to see your primary care physician, are they seeking community care, and they know this all, so they can help the veterans and their family know what to do next. Education on specific documents that are required to apply, just kind of prepping that if they're going to need bank statements or whatever they need, we can help so they're ready. Requesting a DD 214, so that's a separation paper. Sometimes those get misplaced or lost. So we help them request a new DD 214 because sometimes they call it the golden ticket, because if you don't have it, you won't be able to apply for anything. Help applying for VA healthcare, file benefit claims if it's a VSO. We help a lot of surviving spouses to file for benefits, which a lot of times those are benefits that really no one even knows are out there. And follow up with veterans to ensure services were received. And I think that's a big thing. I think that the VA does a great job. Fortunately, since we have this funding and we have just a designated person, we can do a lot of kind of, I'll just say, like the gold service, so to speak. I didn't put on this slide, but which is also a big deal, is that we can also visit veterans that are homebound. And that is not something that the State Department of Veteran Affairs can do. So that's huge. I wish that this program was in California. When my uncle, he's a Vietnam veteran and ended up being quite homebound, and he just waited. He did the typical, oh, I don't need it, I don't deserve it, other people need it more than I do. He was a blue water veteran, that Vietnam veteran, that his ship was on the list. Like, it would have kind of been a slam dunk. And by the time that he finally was kind of ready, it was almost impossible to try to get the paperwork. And even though the VSO only lived like 2 miles away, it just really made it close to impossible. So I find this a real service that we can also go into the home if needed. So we advocate, we'll go to the next slide. We're huge advocates of getting veterans connected now. We mostly work with veterans over 60 coming through the area agency on Aging Door, but we don't want them to wait. Get signed up, get connected. So here are organizations you can see listed, and our points of contact, their information. You can see we have a pretty large area of rural Utah that we're covering. if you're living in a rural area or any area of Utah that you don't see listed here, don't hesitate to reach out to me. I'm pretty well connected to VSOs throughout the state, and we want to make sure that we're getting veterans the help that they need. Below the 4 agencies that are working on this funded project, I just wanted to add the area agencies on aging. I'm not sure how often that you all get engaged with them, but this is a great video. It talks about, it's like 3 minutes, and it talks about all the services and resources they have, veteran or non-veteran, and then locations. So you can just go on the map and hover, and it'll tell you which area agency on aging that you're connected to. Cover to cover, if you want to learn more about it, it's a 3-minute video, a little bit more in depth. And then our State Department, again, I can't tell you, they're a great partner. I put a link to their website, and I was just on it yesterday, and they've just published a couple of videos that are really helpful. So I would highly recommend that. And then I also put down the Salt Lake City VA healthcare enrollment with the direct extension, so you're not trying to figure that out. So that's what I have here. I hope it's helpful. We encourage you. I promise everybody listed on the slide knows that I put their name and number. We are always looking for referrals. We want to help veterans, and that's really our mission. So if there are any questions, please let me know. But if you don't have one at this moment, don't hesitate to contact me. That's what I'm here for, and really, this is my passion project. So please reach out.
I got a few, if you don't mind.
Sure.
Is the VA healthcare, is that something you can panel with, or how does that tie with like TRICARE or Federal Blue Cross Blue Shield?
So you can, and I am not a benefit expert, which these people would know that I have listed, but it's not you can just have VA healthcare. Like you can just say an older adult, may be on Medicare, and then they think, oh, well, which one should I choose? And you don't have to choose one. TRICARE gets tricky, and I would not be able to answer that one for sure. But Janelle, especially in 5 County, she's just so knowledgeable. So yeah.
All right. Thank you.
You're welcome.
Thank you so much. That was really helpful information. I especially love that you shared how the homebound veterans can receive visitors, because that is really huge for the veterans that are older and maybe did wait a little longer to decide to reach out to get that help, because I feel like that is sometimes common in those older veterans who decide they don't want it until they need it, and then when they need it, it's pretty rough. So grateful that that's an opportunity.
It is, and when they tell me the things that they do out in the field, it's pretty wild. But they will go, and if they need to try to set up hotspot and telehealth, they will do what it takes to get the veteran connected if they want to. We're still trying to talk a lot of them into it, but we keep asking and we keep engaging, because we know sometimes it takes more than one ask. So we're here to advocate and get them connected.
Well, thank you so much for that. We're going to go ahead and switch gears now and introduce our next speaker. So thank you, Jennifer, for providing us with an overview of this amazing resource for our veterans. The slides from both presentations will be available on our website that I did link into the chat as well. If anyone would like to reference any of the info from today's information. The Center for Rural Health Leadership is going to be next. So thank you, Jennifer, on that one. So now we're going to start our training for this. We'll now hear from Sydney Grant from the Center of Rural Health Leadership. Sydney is the Chief Learning Officer for the Center of Rural Health Leadership, responsible for the NRHA's Rural Hospital Certification Programs for CEOs, CNOs, CFOs, CMOs, and HR directors, board trustees, and rural health nurses. CRHL also offers coaching, cultural transformation, and other rural health professional development opportunities. Sydney, the time is yours, and we will go to 12:50.
Awesome. Thank you very much. And that was a really great presentation, Jennifer. You guys have a way cooler acronym than I think we could ever manage. So that's pretty cool. But thank you all for having me. Like Kristen said, my name's Sydney Grant. I'm here from the Center for Rural Health Leadership. And you might notice the National Rural Health Association's logo up there as well. We do work with the National Rural Health Association to put on these certification programs. So just to give you an idea of what that's like. But I'm going to run through some more information about all the training and educational opportunities that we are currently running, including the NRHA certification program. So Kristen, we can go to the next slide. So to kick things off, like I mentioned, certification programs, we have a long list, as Kristen shared in my bio. The list has gotten even longer, if you can believe that by now. But here's, again, that list that she ran through. So these are our rural hospital specific programs. I say that because we do have some programs that are not specific to rural hospitals, but this is where we started, was with our rural hospital CEO certification program at the very top there. We do have a chief medical officer / physician leader program. We have a program for chief nursing officers, chief financial officers, HR leaders, board of trustee members. It's a pretty hefty list there. And then on the next slide are some of the other programs that we offer. So not specific to rural hospitals, but we have a program for rural health nurses. So any nurse that's working in a rural healthcare setting. We have a rural health clinic leader program that we kicked off this year. We also have a rural health leadership academy and a rural health management academy. So two programs that are great for first-time leaders or first-time managers in a rural healthcare setting. And then we have two brand new programs that we're kicking off in 2026, a rural APP, which stands for Advanced Practice Providers, and then a rural public health certification program. So we've got a lot going on, and I'm eager to tell you more about how we got started in here and what our goal is. So on the next slide just has a few bullets about what I'll run through next. So what exactly are these programs? Why did we create them? Why would anybody want to participate? And then if there's any questions, I'll be glad to answer that too. But on the next slide here, to kind of kickstart off that first bullet, these programs were created truly for rural health leaders by rural health leaders. Everything we do is rural specific, if you haven't figured that out by now, but that's where we like to be. Rural health leadership is our jam. My colleague, Dr. Bill Oxier, and I like to say we're leadership nerds, and rural healthcare is where we absolutely love to be. So these are very pragmatic, very practical programs. And again, rural specific, which is not something we found in many of the other training opportunities that are out there, which there's tons of great educational and leadership development opportunities, but we knew there was a need for rural specific training because rural is just simply different than urban and what you might find regularly. So on the next slide, this was kind of how we started everything off. This is our basis for almost every single program that we've put together. We recruited what we call our advisory board. So every program that I listed previously on those slides were born out of suggestion. So they weren't, we'd thought about them before, but we always try to go based off of what people are telling us that they feel there's a need for. So all of those programs were born out of suggestion or recommendations to us. But in order to make them very practical and applicable for these people, for these professionals, we recruit an advisory board, which they help us craft our curriculums for each of these programs. And so as an example, I'll stick with our CEO program, but you can kind of apply this structure to any program that we have. So to create the CEO certification program, what we did was recruit an advisory board of successful rural hospital CEOs. got them all together virtually because this was almost pandemic times, but we got everybody together and we asked them what I like to call our favorite question, which is, what do you know now that you wish you would have known then when you first stepped into that role? So as you might imagine, there is a ton of information that we got when we asked that question. And on the next slide, we boiled down all of that information into that curriculum, which, as you can see, there's 4, we call them building blocks, and then we have a different number of modules in each building block. So it's modular based. These programs are based on adult learning concepts and principles. So it's not like an intensive grad school experience. Like I mentioned, we try to make things very practical, very efficient, but very effective. So I digress. We went back and forth with this advisory board many times to make sure we weren't missing the mark here and we were including all of the really important pieces. And so for this specific program, we have 18 modules, so different number of modules in each of those building blocks, but covering leadership, operations, finance, and clinical. So very key topic areas. And with the majority of our programs, we spend 2 weeks on each module. Just to give kind of an idea of what the structure is. And we incorporate both self-guided and group learning. So that really helps to kind of drive home the learnings and deepen the thought processes. And we do a ton of networking, a ton of problem solving together in these cohorts that join for these programs. So again, this is our curriculum, but this is how we come up with each curriculum is truly based on people that are living the experience, not just from what, I thought might be good or what Bill thought might be good, but people that do this every single day and have done so successfully. So that's how we create the curriculums for these programs. On the next slide, to kind of give you some background, which you probably already know if you're involved in rural healthcare at all, you probably know these things already, but there's been a rural hospital closure crisis going on for a very long time. So some data here, 700 plus rural hospitals are at risk of closing, and over 300 of those hospitals are at immediate risk of closing, which is really, really scary. We know that these hospitals are lifelines in rural communities in so many different ways. And so to see that there's such risk, there's such danger to their livelihood, we knew we wanted to do something about that, but what exactly were we going to do? Well, like I mentioned, my colleague Bill and I are leadership nerds, so that's where we dug into first. On the next slide, we have a quote from Alan Morgan. He's the CEO of the National Rural Health Association. We like to use this quote all the time because we 110% believe in it. We truly do believe leadership makes the difference, like Alan shares here. He shared that leadership is the single biggest predictor of rural hospital success, and we think that's absolutely true. Without stable, strong leadership, it is so hard to get anything done, let alone, thrive, not just survive. Excuse me. And so that's where we thought we would get started, was going into leadership and seeing how we could help create a strong, qualified pool of candidates and rural hospital CEOs that can help keep things running, essentially. So on the next slide, I'll dive a little bit more into why anyone would want to participate in these programs. And typically we kind of find there's both personal reasons and then organizational and community-wide reasons. So to start with personal reasons, on the next slide, I have just a few points here. These programs are an absolutely excellent way to improve your leadership effectiveness. So lots of different points that we run through. Kristen, if you could go to the next slide for me, that'd be awesome. Thank you. So like I said, great opportunity to improve your leadership effectiveness, opportunities for growth in lots of ways. So your knowledge, like we saw on that curriculum side, there's a lot of modules that we work through. So there's a lot of great knowledge in there. Some of it might be information that you may already know, which it's nice to know you're doing the right thing and you're on the right track. Nice little boost to the confidence. Some information, folks have told us, yeah, I knew a little bit, but I realized I need to take this a step further. And then some of the information is completely brand new. Things change in healthcare so quickly all the time. It's impossible to stay up to speed on your own. So great resource for that. And to piggyback off of those resources, you get connected with subject matter experts. We recruit the country's leading subject matter experts. Again, they're rural focused subject matter experts. So you have contact with them. You also get to keep all of the content that you get from this program. So all of the video lessons you'll watch, all of the materials, handouts, all that good stuff, we give it to you forever. So you can always go back and reference, the materials that you need. And along with that kind of piece of resources, but also jumping to the national network piece, that is arguably one of the most powerful resources that comes from these programs is the network that you'll create. Oftentimes in rural healthcare, it's isolating, whether that's geographically or just emotionally, or it can feel like you're on an island in a lot of different ways. And so our goal too was to help close that isolation gap and get people connected. It shouldn't be such a secret how people are, staying successful or working through problems, especially in rural healthcare where we need to be banded together. And so we create a nationwide network with each of these programs. So they're open to every state. And we really do get such a diverse group of people that come together, diverse in backgrounds, tenures, experiences, even just that geographic diversity makes such a huge difference when we're trying to problem solve. So that national network, I can't talk about it enough, but that's such a huge piece there. I mentioned confidence. This is a great way to boost your confidence as a leader, again, to kind of show you that, yes, you're on the right track, show you some ways to take things to the next level, and then also give you some new tools and new information to take with you. And then, of course, kind of goes without saying, but if you're a continuous learner, this is the place for you. You'll get all of that and then some, and it's a great way to just stay up to speed and keep forging ahead. So those are just some of the personal reasons why anyone would want to participate. On the next slide, we have organization and community reasons, which of course, better patient care is always the goal. We want to have improved community wellness and well-being across the board. And these programs really do provide an opportunity for that. They can provide you with some great tools to help increase your employee and community engagement. We focus on that a lot in the leadership modules that are in that curriculum. Employee retention and recruitment. I mean, we can't get enough of that right now. There's no silver bullet, I don't think, but this is a great way for yourself and for others. If you get your colleagues enrolled, we find it's great to get people on that same language, same page, and recognition as well. Get some recognition that you're doing everything you can to help keep your facility open, keeping them not just surviving, but thriving. So it's a great way to get some recognition for your community and your facility, which ultimately that's our goal is we want to keep rural facilities open as much as we possibly can. So those are just a few of the organization and community-based reasons to participate in the programs. And on the next slide, again, it's just a quick recap. Ultimately our goal is to improve the health and well-being for all rural Americans. And we know you've got to have a rural hospital, you've got to have a clinic, you've got to have those places open if we want that to happen. So that's ultimately our goal there. So what's the impact? I'm sure you're curious to know, is there any data? Is there information on what the impact has been? And the answer is yes. So on the next slide, we have a few numbers, which again, I just focused on the CEO program because it'd probably take me an eternity to run through all of our programs that we have. But I will say what you see here is pretty standard across all of our programs. So these numbers are cumulative across all of the CEO cohorts that we've had complete the program, which I believe we're at 10 now, 10 cohorts that have graduated. So we have over 200 participants that are now in our alumni network, which, I mean, it's just such an expansive network that's continuing to grow. But back to the numbers. So what we do in these programs is we have a pre and post assessment where participants are self-assessing their growth. So they get a chance to really see and show just how much they grew from when they first started the program. So these numbers are showing increases. So leadership, our graduates have shown a 26%, again, self-assessed growth in their leadership competencies, 36% increase in their operational competencies. That financial piece is huge. We hear that so often, how they might not have learned, financial acumen, things like that, especially with our nurses and our nurse leaders. That's not something that they get taught in nursing school. So we see that huge boost in financial acumen across all of our programs, but that 44% is amazing. And then a 28% increase in their clinical/quality acumen as well. And then at the bottom there is confidence. That's something that we do self-assess as well. So again, it's coming straight from the participants. I didn't make this up as nice of the numbers as they are, but our participants have shown a self-assessed increase in their confidence by 31%. And so that next slide is just highlighting that, because I mean, what growth that is, 31% increase in your confidence. I mean, that alone, I would take that, but coupled with any of those other, categories that I just ran through, I mean, it's a great recipe for success. So we always like to share those numbers. We're very proud of them. And again, that's pretty similar across all of our programs. So huge boost in confidence. We love to see that. And we really do think that makes such a difference for leadership. So to kind of wrap things up here, these are some of the fall cohorts that are kicking off, as well as some of our early 2026 programs. So we do have 2 CEO and CNO cohorts per year, with our fall cohorts coming up in October. We have a Board of Trustees certification program, which is also kicking off in October. October is a busy month for us, if you can tell. And then we're also kicking off a Rural Health Management Academy cohort at the end of October as well. So you can keep your eyes peeled for our APP program, as well as the public health programs that'll be kicking off next year. And then our Leadership Academy, we've had quite a few cohorts as well, but our next cohort will also be in 2026. So just to throw some dates out there for folks that might be interested. And then on my next slide here, these are just some of the additional offerings outside of those certification programs that we have. So we do offer coaching, executive one-on-one coaching, as well as group coaching, if that's something you're interested in. We have excellent coaches. They all are rural specific and rural experienced coaches too. And then we also do cultural transformation projects. So if that's something that you've been thinking about, definitely send me an email. We have a free culture survey. This is not hospital specific. You can be any rural facility for any of these offerings here. But cultural transformation is something we love to do. So if it's something you're interested in, like I briefly mentioned, we do offer a free culture survey. So you can send me an email if you're curious to know a little more. But that about wraps it up for me. So my next slide is for questions, but the slide after that has contact information on it. So if you want to get in touch with me or any of my colleagues, my colleague, Dr. Bill Oxy, are there. Those are great ways to reach us. And then our website is up there too. So that covers it for me. I know that was a mouthful, but I can pause there and see if there's any burning questions on anyone's mind.
Great job, Sydney. Thank you so much.
Absolutely.
I love all that information. Do you know specifics about the courses?
Yeah, absolutely. What questions do you have?
The Rural Health Management Academy.
What would you like to know?
What does that entail?
Yeah, so that's a self-guided program. We typically do have what we call roundtable meetings, where it's for current participants as well as graduates of the program can get together, and it's a 1-hour meeting where it's a participant-led agenda. So while it is a self-guided learning program, we do offer some interactive group learning along the way as well. But it's a 10-week program. There's 10 modules that you'll work through, as well as some bonus modules. I can't rattle them off the top of my head, but I can put the link in the chat for our website there. It's actually just that crhleadership.com/RHMA. And you can find it on the homepage too. But it's a 10-week self-guided program. You can get in and go as fast or slow as you like. And then you'll get a little virtual certificate once you complete it. But it's perfect for first-time managers, or maybe managers that haven't had any formal, management training and are trying to get their feet wet, get a little more into that, which again, it's rural specific. My colleague, Dr. Bill Oxy, leads those modules, and he is an absolute expert in rural healthcare leadership and management. So it is manager focused, and it's great for those first-time leaders, or even, managers that are tenured and seasoned, but maybe haven't had quite that formal training, or continuous learners. Of course, we love those too.
Great. And does a participant need to be a physician or nurse, or in a rural setting or facility?
Just rural, just working in rural. That could be any sort of rural healthcare facility.
Okay. Thank you.
Absolutely. And same goes for our Leadership Academy as well. Thanks for the question, Karen.
Looks like a lot of opportunities to grow in that education. because rural is often so overwhelming unless you have grown up in it and have been surrounded by it throughout your life. Those who choose to venture out into rural, I think, often get overwhelmed. And so it's a good resource for them, and also for those who are looking to support those rural hospitals, because they really, truly are so necessary for even families like mine, families who travel throughout. We travel throughout Utah all the time, and we see these smaller hospitals, and they are just a hub of the area and are so important to keep open and keep access available to everyone.
Well said, Kristen. Thank you.
Yeah. Okay, so I think that's going to wrap up today. I just have a couple of closing remarks here. So thanks again to our speakers and to all of you who have attended the session today. Your support is critical to the long-term success of this series, which is truly providing information that we need. Our next session will take place on Thursday, October 2nd, 2025 at 12 p.m. The October 2025 session will feature presentations from Envision Utah, the early learning project, which provides thousands of free and bilingual resources and free activities, tips to parent and caregivers, and the Donor Connect program, Utah's federally designated organ procurement organization who supports individuals through the organ donation process. You can RSVP for this session using the QR code to the right on the screen. I'm going to just move forward here with this. Here we go. By visiting our website, rhau.org/RHAU-webinar-series. Additionally, the recording from today's session will also be made available shortly on the website. And note, we are also currently accepting applications to be a presenter in a future session. If you can access the application form on the application form on the website. If you are interested in presenting, hurry quickly. We just have one slot left for December of 2025. Thank you again for attending, and we hope that you have a wonderful day, and we will see you in October.
Thank you all so much. Have a great day.
Thank you.
Thank you. You too.